Right, a little bit of physio stuff today. So I am going to do some shockwave therapy on my shoulder. So when I was about 11 years old, I fell off a rope swing and dislocated, I think it was posterior, smashed the head of my humerus up. So now that I'm perimenopausal, a lot of the stuff that I get pains with is the sort of fascial stuff and the soft tissue. So don't really get joint pain anymore, which is brilliant. Don't really get many symptoms. Yeah, I have a bit of brain fog. Yeah, I get a bit angry and a bit upset sometimes, but that's just, you know, part of it. But one of the things that has been affecting me is just the pain in my shoulder. I've got full range. It's a bit stiff. But certain movements, like one of the worst things is putting my phone into my pocket, that movement there, that little bit of internal rotation. So I think I've probably got a little bit of calcification in there. I can actually feel it feels all a bit gunky in there where I had that nasty break. So there's probably a little bit of scar tissue in there. So it just hurts a little bit. I'm really strong, I can do all my weights, I can do overhead stuff. The thing that I'm struggling with is a little bit of, I've been doing some lateral raises with the cable machine. I'm really weak on this arm, so I've programmed that in to do some work through there. If you look, I don't know if you can see, if I bring my arm up, you can just see that humeral head just lifting up. If I'm doing some lateral raises, that's really quite uncomfortable. It just doesn't quite move as well as I want to. I have had it ultrasounded and there is a bit of, it is a bit gunky in there. So I'm gonna do some radial shockwave therapy on it just to see. It's a really quick, simple treatment. And it can help for soft tissue pain. And again, it's not joint, it's all the soft tissue. I can feel all that gunkiness in there. I've got biceps head into there, I've got the rotator cuff, shoulder capsule. That's all the sort of tissues that are really affected by perimenopause and that drop of estrogen. All this stuff loves estrogen, so as estrogen drops, this becomes less healthy. I do think as well, again, this is just my opinion, if you've had old injuries, the scar tissue again can become quite stiff and tight through menopause. There's research around like your fascia decreases in quality because fascia loves estrogen. So all the things that I do for myself, probably don't drink as much fluid as I should be doing. I've switched on to the alkaline hydrogenized water, which again there's some evidence now coming out around that about how beneficial that is for your fascia in your body. I lift weights, I do my mobility, I do my yoga. I don't have any range of movement restrictions. I take ibuprofen when I need to, because that really helps. Again, estrogen is our body's anti-inflammatory as well, so a drop of estrogen, we're maybe more likely to feel aches and pains that we maybe wouldn't have before we hit perimenopause. So I'm going to do a little bit of shockwave on myself. Now let's see how this goes. So one of the best ways to kind of get into this area here is just to pop your hand behind your back. Now I'm going to set it quite low because obviously I'm doing it myself. So we'll see. It's quite a quick therapy. So I've been doing this on my heels as well, so I've been getting quite stiff through my heels. That's really been beneficial for me, but I've been doing it regularly. I think I'm on my 5th session. I've been doing my yoga regularly, some hands-on stuff, using my massage gun. So lots and lots of regular treatment on it. So we're going to see. So pain-wise, probably movement-wise, like maybe like a 3 or a 4. It doesn't stop me doing things. Sometimes I wake up and it's just sore at night. I think it just gets all a little bit stiff. When I'm doing certain movements, I can feel, you can see it it wants to lift up. So working in the gym, just trying to get that better form when I'm doing my weights as well, being a little bit more conscious of what I'm doing. So a little bit of ultrasound gel on. I've got it set quite low on the settings, and you'll hear like a click noise. And I'm just going to pop it onto the area where it feels sore, so right on the tip of my shoulder here, and then down into like bicep tendon, into all this soft tissue. It really feels quite grubby in there. I've been doing some deltoid strengthening exercises as well, so I'll pop those in just to show you what I'm doing with those. Here goes. Right, I'm going to turn it on. I'm going to put my arm in this position. So it's a little bit uncomfortable is what I would say. So I'm just going to move it over that soft tissue rather than keeping it in one place. So we're doing about 2,000 shots. About 1 bar. I'm on about 12 hertz, so 1 bar is quite low. And I'm aiming to I'm going to do this over the next 4 weeks to see if it makes any difference. I'm being very brave. Actually, not too bad, not too sore. A little bit into there. And I can feel where the soft tissue really changes under the head of the gun. So the evidence is really quite varied. For some conditions, radial shockwave can help. Some conditions, it doesn't really make much difference. Your body's still got to heal from the injury. You can't really rush healing time. And what I found actually, doing some soft tissue work with this has been beneficial. So if you're getting myofascial pain, actually a bit of shockwave can be really useful. It's not a magic cure though. Actually, it's not bad. Pain-wise, I did too. There's quite a lot of soft tissue around those bony parts of the joint. Cool. So let's see how that feels. So yeah, it does actually feel a little bit better. So I'm going to document this. What I'm going to do, we'll wipe the gel off. I've got some exercises here. I'm going to try and help to strengthen the deltoids, which kind of help support the rotator cuff as well. So, and I'm really working, like looking in the mirror and working on my form. I know just from watching myself that my shoulders, it lifts up, that humeral head kind of pops up a little bit. So I'm just going to put in like what I'm working on in the gym from like working on my deltoids. I've also been like my pull-ups. I love doing my pull-ups, and that's really important for like shoulder strength as well. So I'll just pop a little thing about how I'm working on those. We'll come back next week, sort of 7. Well, I'll do it next week. We'll see where we're at, and yeah, fingers crossed. It might feel a little bit easier. Actually, feels a little bit better already. That's the. Yeah, so we'll see how it feels later on. Aftercare wise, 48 hours. I'm not going to be like doing burpees, thank God, and I just recommend not to take anti-inflammatories. However, I have found with my foot, when I've been doing the shockwave on my heel, I don't take anti-inflammatories for like the first maybe 36 hours, but then actually I take one, and that's really helped. But again, because you know my estrogen is dropping, maybe I'm just a little bit more aware of stuff, so kind of going against what the protocol says, but for me that's really helped. I actually even ran in my barefoot sandals the other day, which I haven't done for such a long time because my heels are so sore. So yeah, so we'll see how we get on with some shockwave therapy. If you've got any questions about it or you want to try it, I mean I've got 7 weeks left in clinic, so I'm all in now. If you want to just come and try it, come and have some sessions, use it, and we can see like plantar fasciitis, shoulder stuff. I've used it on hips, myofascial pain. It can be really useful for that, and again, it's really low risk. May as well give it a go. So if you're interested, just drop me a message. and we can have a go, and I will keep you posted about my shoulder. All right, take care.